Alrighty, so I get a lot of questions about my nursing internship that I'm currently doing, but the most commonly asked question is, what do you do as an SNI, student nurse intern? Basically, what I do is everything an RN does under the supervision of an RN. Some were asking me like, oh, are you like a CNA then? Are you doing like PCA, CNA work? So some people were asking me, oh, so do you do like CNA work? Like, are you a CNA? And no, I'm not. I am doing the role of a RN. So I actually delegate tasks to CNAs. Personally, I don't do that because I am, an intern and I don't want to like ever step out of line just yet. But if, for example, bed baths, or bedpans. If I'm in the room and my patient needs to use the restroom and they're bedridden, then yeah, I'll turn them over and I'll do it myself. But if I'm kind of busy and I kind of have to run to another patient, then you can delegate that task to a CNA and be like, hey, bed 4 needs a bedpan. Then the CNAs will do it. So I don't do all those things. I actually am the RN. Last week I was put with the charge nurse, and in critical care in the step down we each have 3 patients, so it's 3-to-1 nurse ratio. And on the first day she was like, all right, I'm gonna give you 1 patient, you're gonna do your assessment, you're gonna chart everything. And holy crap, I'm pretty sure nursing 98% of it is charting and the other 2% is actual bedside care. Just kidding, it's like not that bad, but the charting is ridiculous. You literally chart your every move, every doctor's phone call, every turn, everything that you do on this patient. This week I worked a triple, so I worked Thursday night, Friday night, and Saturday night. This past Thursday, she gave me 2 patients now. She's like, okay, I'm gonna give you these 2 and you're gonna do your assessment and you're gonna do your charting, so you're responsible for these 2. And then just last night, I had the whole group. So how that works is literally I do all my assessments, I chart everything. Because I am a student, I'm under her, so she would go in and just double check my charting to make sure everything is a-okay, and then she confirms it or she'll edit it. When it comes to med drawing, I actually have access to our Pyxis, which is our med machine, med room thing. And I have my username, I use my fingerprint, I pull meds out, I give meds. Of course, it's under the nurse's supervision. I always have her check my work, I always have her check my units if they're like insulin, because you don't play with that stuff. So I always have her double check, but I do everything. So for example, yesterday I had a patient with a trach tube, and we have to suction it every once in a while, right? Every 2 hours. So I was just putting it in, and then you like squeeze it and you suction. So I suction trach tubes. I do, I provide the oral care, especially with trach tube patients, all that bacteria in the mouth. What I do depends on my patient's diagnosis. So for example, if my patient had DKA and they're on an insulin drip, I am hanging the insulin, I am titrating based on the client's weight, I am taking blood sugars every whatever hours that Glucomander tells me. My hospital uses Glucomander. It's where you put in the blood sugar and they calculate it with the carbs and they tell you how many units and all this good stuff, right? So it depends on the client. If my client came in with a stroke or they're a CVA patient, then I would do a neuro assessment every 4 hours, check their pupils, check their grip, facial symmetry, all that jazz. So what I do depends on the clients that I get. Yeah, so those are the patients that I kind of deal with. And yeah, so what I do depends on my patient, but pretty much I do everything. And she gives me, I have the little med scanner, I scan the meds, I do everything. She just stands by the door and she just watches me freak the fuck out.